Good morning, everyone from Liverpool. My name's Claire Pritchard. I'm the lead nurse for emergency services. This is Rachel from the Samaritans, and this is Kelly, who's our telecommunications engineer. So Aintree Hospital has over 700 inpatient beds, and we serve a population of 330,000 in the north of Liverpool, South Sefton and Kirby. These are our areas. And the hospital provides care and treatment for some people living in some of the most deprived areas of the country. The Trust is part of the Cheshire and Merseyside Major Trauma Centre Collaborative, and we receive all the major trauma cases for the area. And the emergency department provides treatment for over 80,000 patients per year.
Okay, so I'm just going to talk a little bit about the work that Samaritans does. So Samaritans are a service that are always available 24 hours a day, 7 days a week, every single day of the year for anyone who needs us. Samaritans are available at all times to provide emotional support for people who are going through a difficult time, including but not exclusively anyone who might be having suicidal feelings. Samaritans reaches out to high-risk groups and communities to reduce the risk of suicide, and with the aim of preventing or causing suicide as an option. So since July 2018, Samaritans Liverpool and Merseyside and Liverpool University Hospital's Aintree site have been working together to provide emotional support to the patients and the staff of the hospital. Samaritans Liverpool and Merseyside work in cooperation with the emergency department to provide emotional support to some of the most vulnerable patients who often require a listening ear to alleviate distress during their visit.
Liverpool University Hospital Aintree site provides guidance to the Samaritans on the hospital policies and procedures, with emphasis on DBS checks, personal safety and safeguarding. Through our joint working, we now have an established process for volunteer recruitment, and that includes attendance at the Trust Induction Day. We have a memorandum of understanding in place, and there is also regular liaison between myself and Rachel, who are the leads for the services, to make sure that everything is smooth running with the partnership. We believe that this has been pivotal to our ongoing success and partnership. As both of our services are dedicated to saving lives, we will continue to work together in suicide prevention and promoting better mental health and well-being to patients and to staff. Our joint strategy can only strengthen both of our services and offer excellent care to all sections of our communities by directly reaching out to groups at high risk of suicide through our outreach work, and the Samaritans hope to increase awareness of the service to those who wouldn't ordinarily access them. The success of the partnership has been in developing a joint working relationship, which includes promotion and publicity to raise awareness. And the outreach is promoted through the emergency department and will be on the Trust website. The Samaritans have also created a digital advert that displays the opening times for face-to-face drop-ins at the Liverpool local branch. We've also worked together to strategically place a number of Samaritan crisis signs at high-risk areas on the Trust premises. The vision for this partnership is that fewer people will die by suicide. During COVID, of course, everything changed, all of our lives changed, and everyone's anxiety was heightened. Rachel and her team of volunteers could no longer attend the department. So we've actually installed the phone line, which has been amazing. We've had an amazing response from the staff and from the public. And so the phone line is a direct phone line that is there in our waiting room. And we've had it installed now for about 7 weeks. So far, we've had 10 phone calls because we can monitor how many times the phone is used. And this is a free and direct line to the Samaritans helpline that is open 24/7 every single day of the year. And we are planning a publicity event to promote this later on in the year, because unfortunately we can't really promote it, to the wider group by making films and things at the moment due to COVID-19. But our aim is to run the service across the city to our other hospitals, because we're a merged organisation with the Royal Liverpool Hospital and Broad Green, and our idea is to have a phone in every hospital, and our dream is to have a phone in every hospital in the country. Through our partnership, we hope to influence public policy and raise awareness of the challenges of reducing suicide. We will do this by promoting and publicising the work that we have been doing. We also aim to develop strategic partnerships and programmes through identifying and working with relevant authorities, agents and organisations and individuals.